Hi students, welcome as we continue to our lecture on abnormal psychology. We're going to start talking about schizophrenia. Sometimes one of the questions a lot of psychologists will hear is schizophrenia the same as a split personality? Schizophrenia literally means broken personality, but it is not the same as split personality or the idea of multiple personality. That we've discussed at a different point in the lecture. Really what schizophrenia is a pattern of severely disturbed thinking, emotion, perception, and behavior. So it is not multiple personality, but really a diagnosis in and of itself. It is its own diagnostic criteria. And schizophrenia is pretty consistently represented in about 1 to 2% of the world population. We do have a tendency to see this in more economically disadvantaged populations, and we'll talk a little bit more about why that might be. It occurs equally in both men and women, and it tends to develop in adolescence or early adulthood. So often we see the onset of schizophrenia happen right around 17, 18, 19, up until about mid-20s, even late 20s. The best predictor of outcome is really premorbid adjustment. How well adjusted was the person before the onset of their symptoms? How was their support system before the onset of their symptoms? That is going to be our best predictor of adjustment. When we think of symptoms of schizophrenia, we think of positive symptoms and negative symptoms. Positive symptoms mean a distortion of normal function. So it's going to be things like disordered thinking. For most psychologists, schizophrenia is defined as having both hallucinations and delusions. Hallucinations are false perceptions of objects or events, mental images that are so vivid they seem real. So hallucination really is seeing or hearing things that are not there. Delusions are false beliefs. Some different types of delusions include things like delusions of persecution, believing that people are out to get you, or believing that people are out to harm you or your family. Delusions of grandeur, thinking that you are a famous person. The Simpsons do a funny skit where one character who is in a mental health institution believes he's Michael Jackson. There is a book called The Three Jesus of Ypsilanti, where three different patients in a mental hospital all believed that they were Jesus Christ. And when asked about the other two, they would say, well, he's a fake. I'm the real Jesus Christ. And also delusions of control. Things like thought broadcasting. Other people can read my thoughts, or other people can hear my thoughts, or thought blocking. The government, the FBI, aliens have put something in my brain so that I cannot think properly. Other positive symptoms include disordered behavior, constant movement and ritualized patterns. Things like pacing back and forth, behaving in a way that seems very agitated, or also withdrawn, very little movement. Disordered speech, things like neologisms, saying meaningless words, or word salad, words that are tossed together that just don't make any sense. In terms of negative symptoms, what we really see is a loss of normal function. So things like alogia. Alogia is a poverty of speech. The person does not speak. Avolition, a lack of motivation or poor social skills. Perceptual disorders, flat affect, being without emotion, or having an exaggerated or inappropriate emotion, laughing hysterically at inappropriate times, or crying hysterically at inappropriate times. Deterioration of personal hygiene. The person does not shower, they do not bathe, they don't change clothes. They say that showering is painful or it's overwhelming. And a general inability to function on a daily basis, an inability to take care of your daily living activities. When we think about causes of schizophrenia, for the most part, we focus in on biological factors. Now, there is no one single cause that can account for all forms of schizophrenia, but for the most part, because the disorder happens so consistently across cultures, we have really turned to biology or biopsychology in order to help us to explain the causes of schizophrenia. So we've turned to things like genetic factors, and we know there's some sort of genetic link. We know that it runs in families. Children with parents who are schizophrenic are 10 times more likely to be diagnosed with schizophrenia themselves. But genetics can't be the full picture. When we look at twin studies, and if you remember twin studies, those are those identical twins. They share 100% of their genes that have been separated at birth. We see that it's 48%. So if one twin has schizophrenia, there's about a 50% chance the other twin will develop schizophrenia, as opposed to 17% for fraternal twins. Now, fraternal twins are just like regular sibs. They share maybe 30-40% of their genes. If one twin develops schizophrenia, there's about a 17% likelihood that the other fraternal twin will develop schizophrenia. So this researcher tells us that there's probably some sort of genetic component. We know that when we look at this statistic of 17% for fraternal twins, we know that in the given population, if one random person develops schizophrenia, the likelihood that you will still remains at less than 2%. So 17% tells us there's some genetic overlap going on. And when we look at identical twins and we see that it's nearly 50%, we know that genetics plays a large role in this. However, that also tells us that 50% of identical twins do not develop schizophrenia. So there's got to be some environmental factors that are also contributing to this disorder. Other biological factors that we look at include brain structure and function. We know that people who struggle with schizophrenia have less tissue in areas that control for emotional expression, thinking, and information processing. And finally, and I would put a little star by this in your notes, because this is one of the main ways that we explain schizophrenia, is we look at brain chemistry, we look at neurotransmitters, and we do see an excess of dopamine in individuals that struggle with schizophrenia. We believe that it is these high levels of dopamine that are causing the hallucinations and causing those delusions. When we think about how environmental and genetic factors might come together, we're really looking at possible neurodevelopmental abnormalities, so disruptions in brain development from conception through childhood. So things like physical trauma or birth complications might be a contributing factor. Viral infections, prenatal drug use in mothers, and this idea of brain pruning. So at various points in childhood, the first time being during the toddler years, and the second time being in early adolescence, 12, 13, the brain goes through a process of pruning where it pulls out all those unused neural connections. It sort of cleans out the brain. And we believe that this doesn't happen in people that have schizophrenia. So the thinking here when we look at these neurodevelopmental abnormalities is that what may be possibly going on is that the person has a genetic predisposition and something happens in the environment that causes that person to develop schizophrenia. When we look at the genetics of schizophrenia, we have not been able to identify a single gene that is responsible for the development of schizophrenia, but rather we think it is a combination of genes, maybe even up to 6 different genes that may be contributing. So some psychological or sociocultural factors, they can contribute to the appearance of schizophrenia and influence its course. These factors include dysfunctional cognitive habits, the stress of urban living, the stigma of being labeled with severe mental disorder, being an immigrant, and exposure to stressful family communication patterns. So often what we say is that stress in the environment can be a contributing factor to sort of tripping that person off or causing them to start to go down the road in this mental health issue. So I've already talked a little bit about vulnerability, this idea that a person may be vulnerable to schizophrenia because biologically they are genetically set up. We know that different people have differing degrees of vulnerability, and that's influenced by genetics, but that's also influenced by environmental risk factors. It's the psychological components that help determine the appearance and the course of schizophrenia. If that person is going to get help, what kind of help they get, and so on. So early on, when I discussed that we see schizophrenia often in people who are struggling with poverty, one thing to keep in mind is not that there's a more genetic prevalence going on in that population, but rather there's more environmental stressors going on. So when we talk about vulnerability to schizophrenia, what may be going on here is, like the general population, people who live in poverty, about 2% may be predisposed to schizophrenia. But because their living situations are so stressful, they have a higher degree of vulnerability to the disease. Okay, we're going to move on now to talk about personality disorders. So I wanted to make it really clear, schizophrenia is not multiple personality disorder. It's also not a personality disorder. And we're going to talk about this in a little bit of detail. A personality disorder is a long-standing, inflexible way of behaving that is maladaptive. When you are dealing with someone who has a personality disorder, they are very entrenched in the ways that they view things and the ways that they think about things. And so any of you that may be interested in doing clinical work, people that do counseling or become psychologists or psychiatrists will say that people with personality disorders are often the most difficult to treat because their ways of behaving are so entrenched that they don't find themselves to have a problem. You're the one with the problem. The people that are around them have the problem, but they don't have the problem. According to the DSM, we organize personality disorders basically in 3 clusters. The first one is odd-eccentric, which is cluster A. Odd-eccentric personality disorders include paranoid, schizoid, and schizotypal. Dramatic-erratic, which is cluster B, which includes histrionic, narcissistic, borderline, and antisocial. Anxious-fearful, which is cluster C, things like dependent, obsessive-compulsive, and avoidant. And I'm going to go through a couple of these with you guys so that you can get a handle on defining these personality disorders. I want to start off with antisocial personality disorder because this is seen as the most serious, the most costly, and hence has been the most intensively studied personality disorder that we have. When we think about antisocial personality disorder, the way that we define this is by a long-term pattern of irresponsible, impulsive, unscrupulous, and sometimes criminal behavior. We see this pattern, it often begins in early childhood or early adolescence, and then it continues on into adulthood. What sets them apart from other individuals who might engage in crime is that they have a complete lack of anxiety, remorse, or guilt for their behaviors. They feel that as long as the behavior benefits them, there is nothing wrong with engaging in that behavior. So what causes that? We believe there might be some sort of genetic predisposition, and there is the impact of environmental conditions or other social cultural factors. And it's probably a combination of all 3. Other personality disorders include paranoid. Paranoid personality disorders where you are suspicious and distrustful of others. Narcissistic, where you have an exaggerated sense of self-importance. Everything is all about you at all times. Why is that person crying? Probably because of you. Why is that person wearing a red shirt? Oh, the narcissist would say, it's because of me. Histrionic, excessive attention seeking. Emotional excessiveness. People that are histrionic cry easily, laugh easily. They want to be the center of attention, but their emotions are actually quite shallow. They're putting on a show and they're acting, but they're not feeling things deeply. Borderline. Most borderlines are women. This diagnosis is more often given to women than it is to men. People that struggle with borderline often show an instability in relationships, self-image, and feelings. They often engage in impulsive behavior. They are promiscuous. They gamble. They shop excessively. They abuse drugs and alcohol. They may engage in self-mutilation. And a lot of these behaviors are motivated by a fear of abandonment. So one thing we'll see in people that are borderline is they do a lot of what we call triangulation, where they'll develop, say, have two boyfriends at the same time and just move between the two of them. Or they will manipulate friends to be against one another in order to feel as if that's strengthening their relationship with them. Avoidant personality disorder. This person feels a lot of social discomfort, they feel inadequate, and they're hypersensitive to negative evaluation. They generally avoid social situations and avoid people. Dependent. A person who has dependent personality disorder is clingy. They engage in a lot of submissive behaviors. They need to be taken care of. Every small decision needs to be discussed. I had a good friend who became a clinician and ended up, when she was doing her internship, with a person with dependent personality disorder on her caseload, and the person would call her up constantly for the most simple decisions. I don't have groceries, what should I do? What should I buy? When should I go? How should I get there? Obsessive compulsive. This person has an excessive concern for perfectionism, orderliness, and control. Very concerned with being rule-abiding and having a rigidity in terms of things happening on a schedule. All right, we're going to spend a couple minutes talking about mental illness and the law. This part of the lecture supports the discussion board that I've posted, where you are to discuss the insanity plea. Can insanity protect criminals from punishment? So insanity, it's a legal term. It's not a psychiatric diagnosis. And the term insanity is meant to provide legal protections for defendants with severe psychological disorders. So a person may be declared insane if they are mentally incompetent to stand trial. In other words, they don't understand. They don't have a good understanding why they are there or what they have done. They may be judged not guilty by reason of insanity if they cannot judge the severity of their behaviors. So being judged not guilty by reason of insanity if mental illness prevented them from understanding what they were doing, from knowing what they were doing was wrong, and from being able to resist the impulse to do the wrong. Insanity verdicts are very, very rare. We hardly ever see them. Sociocultural values shape views of abnormal, as well as the extent to which it relieves responsibility for criminal actions. In other words, most people in our culture and in our society take the viewpoint that if a person does something wrong, they need to be held accountable for it, even if that person struggles with a mental health issue. They take the viewpoint that if a person has engaged in a criminal act, they have to take responsibility for that behavior. So posted up is the case of Andrea Yates. Here she is right here. This is an image of her with her attorney. And to give you a little bit of background on Andrea, She was married. She was married to a gentleman who was an engineer for NASA, and they had children. They were very religious, and she ended up homeschooling her children and started to suffer from severe postpartum depression. Even after the doctor had discussed with both her and her husband that she should stop having children, she continued on under the premise that she would have as many children as God gave her. So she was struggling with postpartum depression. It continued to veer into postpartum psychosis. She was overwhelmed. She could not take care of her children. And ultimately, she drowned her children. She murdered her children. So why don't you go ahead and read the articles attached regarding Andrea Yates and discuss it.